You mentioned some drugs, some antibiotics that even you are saying in UK, maybe they are going down in its usage. But what are some of the major medications commonly misused or abused in Ghana, from where you stand as a professor of pharmacology?
The list is endless, Reverend. Let me emphasize that anytime you are given a prescription, whether it's for treatment of your hypertension or your diabetes, all right, and you are not taking it according to the instructions that you are given, you are misusing it, you are abusing it, all right, and you will never get a full benefit. So every medication can be abused. Let me put it that way. Every medication has the potential.
Not necessarily those on weed and tramadol, but even those that medical doctors, pharmacists are prescribing.
Yes, has the potential to be abused or to be misused. But for the sake of the viewers, let me mention some of the commonest drugs on our market that we abuse. I don't know, but we did a small research, undergraduate students, and I sent him to a hospital in the Ashanti region. And she was just looking at the prescription patterns from that hospital. Reverend, the result was interesting. About 90% of the prescription contained paracetamol. So on every sheet of prescription, in 90% of cases, it contained paracetamol. But people don't know that paracetamol is a very dangerous drug if you take in overdose. Let me emphasize that if you take paracetamol in overdose, it is very dangerous because it has the propensity to affect the liver. And you know the importance of the liver in the body, you know, getting rid of all the toxic substances. So anytime your liver is affected, you are in trouble.
But it helps us to relieve pain as well, or?
Yes. So you have to keep, even as you want to relieve your pain, you have to keep within the dose that is given you. Sometimes paracetamol is written on a prescription and they say PRN. PRN means that as and when necessary, you take it. So if you give me paracetamol as a patient or as your client, I won't take it like 2 morning, 2 afternoon, and 2 evening, or 2 at night. I will not do that. If I'm not in pain, there is no point because it doesn't do anything apart from relieving you of your pain. Is that okay? So you have to be careful. There is no pain. There is no need for paracetamol, knowing that it can be dangerous when you take an overdose. Painkillers are abused. The ones we call non-steroidal anti-inflammatory drugs. Ibuprofen, you know ibuprofen, a smart student, you know ibuprofen. You know diclofenac. These are used also to control joint pains, inflammation, etc. But you have also to know that when you take them in excess, you are likely to develop peptic ulcer.
What is it?
Peptic ulcer.
Yes.
Oh, the ulcer, ordinary ulcer,
okay.
Where there is how do you call ulceration, or let me put it for the benefit of my viewers, wound, all right, in the GIT, in the gastrointestinal tract, in your stomach. Misuse, you're going to get that. Reverend, there are other drugs that are used a lot also. We call them hypnosedatives. And examples are diazepam, the one that they call volume, the blue tablets. They are very useful when somebody is anxious about something. He can't sleep, sleeplessness. He's bereaved and that kind of. He goes to see the doctor, may write it for the patient within a prescribed dose. But people abuse it a lot. When you take it, you are drowsy and you have to sleep. The young men will take it, all right, they will not sleep, and then they will walk about in town, enjoying the, how do you call, drowsiness and misbehaving as a result of that. Reverend, that drug is abused a lot.